Hello, welcome to my channel. This video follows the previous one on hepatic encephalopathy, so if you missed that one, I recommend you to watch that too. This time we are going to see which blood parameters can indicate liver disease. First of all, hepatic testing can be divided into disease tests, which are the liver enzymes, and function tests, which include substances that are produced or metabolized by the liver. About the enzymes, we can divide them into those that leak from hepatocytes and those that come from biliary epithelium. An important thing to remember is that the magnitude of elevation of hepatic enzymes may not correspond to functional abnormalities. Let's consider first the enzymes that come from hepatocytes. Sorbitol dehydrogenase and glutamate dehydrogenase are highly specific for hepatocellular disease, and they also increase quickly after a liver problem in about 12-18 hours. Very mild increases can be recorded also in case of hypoxemia, fever, endotoxemia, septicemia, intestinal disease, or administration of drugs that should be metabolized by the liver. Other enzymes that still come from hepatocytes are aminotransferase, alkaline phosphatase, and lactate dehydrogenase. But these are not specific for liver disease, as they have high activity also in other organs. AST can come also from muscles, ALP from bones, intestine, kidneys, and placenta, and LDH from muscles, intestine, kidneys, and erythrocytes. Gamma-glutamyl transferase is another liver enzyme that is produced by the biliary epithelium. Also, this enzyme is considered specific of liver disease in horses because only other two organs produce GGT. The kidneys, but in this case GGT is released into the urine and not the blood, and the pancreas, but pancreatic diseases are considered rare in horses. Something important to consider with GGT is that foals up to 1 month of age may have higher values than adults. Also, donkeys have usually higher values than horses, and in case of colic, GGT can increase due to cholestasis secondary to intestinal displacement or inflammation. Intensive exercise and drug administration can also cause a moderate increase in GGT. Okay, now parameters that instead tell us about the function of the liver. They can also be divided into specific and non-specific of liver disease. The specific ones include bile acids, direct bilirubin, ammonia, and the ratio between branched chain amino acids and aromatic amino acids. Well, bile acids are obviously very specific of liver problems, although they can increase also a little bit in case of anorexia, but it should be a really prolonged anorexia for at least 3 days. While ammonia is instead produced by the intestine, if you remember the previous video. But the liver is responsible of the conversion into urea. So if the liver doesn't work properly, ammonia will increase and urea will decrease. Now, sometimes in case of severe intestinal diseases, there can be such a lot of production of ammonia that even if the liver is okay, it cannot metabolize it all. But this is a more rare cause of hyperammonemia. Now, what about bilirubin? Why I said only direct bilirubin is specific of liver disease? Well, because bilirubin comes from the metabolism of hemoglobin and in the liver is conjugated and eliminated. Conjugated and unconjugated or direct and indirect bilirubin together make the total bilirubin. So the unconjugated or indirect one can increase also in absence of hepatic disease, such as in case of hemolysis or anorexia. Also, neonates normally have more unconjugated bilirubin than adults, most likely because of the turnover of fetal hemoglobin to adult hemoglobin. And also, prematurity or illness can further increase this unconjugated fraction. Okay, so now coming back to the markers of liver function, there are others that also change with liver disease, but they are not specific of hepatic problems, such as total or indirect bilirubin, as we just saw, a decrease of urea, and a decrease of albumin and increase of globulins, because these changes in albumin-globulin ratio are quite common of any inflammatory disease. Also, prolonged coagulation times can occur in absence of liver disease and just due to severe inflammatory reactions. Okay, and this is the basis of the interpretation of blood analysis for the evaluation of liver diseases. Unfortunately, the alterations of blood markers do not tell us which is the cause of the liver disease. And also about the prognosis, probably the histopathology of liver biopsy is what is more correlated with the outcome, as presence of irreversible changes such as fibrosis are associated with non-survival. Within all the blood markers that we saw in this video, bile acids have been found correlated to the histopathological score, but it's not a very sensitive marker, as in some horses, even if they are high, then they quickly reduce with the instauration of the treatment. So serial measurements will probably be more accurate to establish prognosis. Well, that's all. Thanks for watching. Bye!